if you're menopausal and having unbearable symptoms and can't take hormone replacement, what do you do? Well, you can sit in the fridge, as this lady is doing, or you can take some medications. Something that I use in a lot of my patients who I make menopausal because of breast cancer treatment is I give them vitamin E. Up to about 600 units a day seems to help with a lot of women. The risks are very low, side effects are low, and a lot of people do get some benefit. Various antidepressant drugs can actually help very nicely with the hot flushes. There are many different products on the market that can work. There are also blood pressure medications that can help with the hot flushes. The one that we quite often use is something called clonidine. And then there are other drugs. This is kind of an anti-epileptic drug called Morton that can help with hot flushes. And in people having unbearable symptoms, it's certainly worthwhile trying something like that. So in conclusion, for menopause, hormone replacement is not recommended if you've had a history of blood clots, and unfortunately, you're left managing the symptoms. So to conclude, before I open it up for questions, estrogen increases the risk of blood clots. For premenopausal women, if you've had a blood clot or have a family history of blood clots or thrombophilias, you should be tested for the thrombophilias before going on any estrogen-based contraception. If you've already had a blood clot or you have a known thrombophilia, progestin-only contraception, IUDs, or barrier methods are the best. For pregnancy, Lovenox and heparin are the safest drugs. In fact, low molecular weight heparins in general, I shouldn't have put that in. Anticoagulation can prevent blood clots in women at risk for them during pregnancy, and anticoagulation can protect against pregnancy complications in women with thrombophilias. All women at risk for blood clots should have postpartum anticoagulation because this is the highest risk time. For menopause, avoid estrogen replacement and try as best as possible to manage the symptoms. Thank you very much, and I think we've got plenty of time for questions.
Do fibroids put a woman at increased risk for blood clots?
Fibroids are really an overgrowth of the musculature of the uterus. They're very common in women as they get older, and quite often they cause discomfort, irregular bleeding. They're a benign tumor, though. They don't really cause any, it's not a cancer.
What are the risks of osteoporosis with Coumadin during pregnancy and during menopause?
Coumadin does affect cartilage and bone development in fetuses. And in fact, when the baby is developing, a lot of the abnormalities that the baby can have is in relation to bone and cartilage issues. There shouldn't be any higher risk, but I did see something that there may be an increased risk. So I don't know for absolutely sure, but honestly, once we get into the menopausal state, we should all be taking our calcium and vitamin D and having our bone mineral density checked. They're very good drugs to counteract osteoporosis. Certainly the risk, if there is any, is not high like it would be on heparin or Lovenox.